Are you familiar with the link between dizziness and head injuries? If you are suffering from dizziness, you know how frustrating it is. You go to your doctor, and in school, what would happen? We would give you a medication such as meclizine, which is meant to help with your dizziness. We would also give you nausea medications. The problem is, for so many patients who receive those, it doesn't work. And you go and get your scans, and your scans come back as completely normal, and you're not sure why you're having dizziness, but it's frustrating because you're getting tossed around from one place to the other without an answer. So what is the link between head injury and dizziness? Well, when you sustain a head injury, a couple things happen. One is that your balance centers really take a hit. So your ability to feel stable gets impacted. So this can lead to you feel like you're shifting side to side, forward and back, and just feeling off balance. Now, our balance is made up of two primary areas. One, it's the information that we get from our eyes. Eye movements are routinely impacted with a head injury, but they're also, unfortunately, not evaluated in much depth at all. You may go to an eye doctor because you feel your prescription's off, but that's not the proper evaluation for eye movements. Whenever your brain is getting information from your eyes and it doesn't trust it, it has to create its own reality. And unfortunately, for those who have dizziness following a head injury, that reality is caused because the brain isn't sure what to do. So eye movements is one. Next is your vestibular system. When most people hear about the vestibular system, it's the inner ear is one small part of it. Okay, that is not the whole thing. Anytime you go up in an escalator, elevator, turn your head, your vestibular system has to activate. If your vestibular system is unhealthy, then just like your eyes, your brain says, okay, I'm not sure what's going on, but here's our reality. And the problem is, when it's not the real reality, you feel off and you feel dizzy. Good news is, as we identify what's happening within your vestibular system and your oculomotor system, your eye movements, we're able to rehab them, reconnect them, and the dizziness that you've been dealing with, whether it's for days, months, or years, is able to lessen and reduce in a very short matter of time. And you're able to keep the results because you now have the tools to help your brain to heal and improve and connect.